For this video presentation, I will be discussing Japan's coverage, quality of care, cost, and healthcare services option. Japan is the world's fastest aging country, with the total population estimating to be more than 127 million. To start off, Japan's constitution believes that citizens have the right to health, and promotion of social welfare and public health is the government's responsibility. Prime Minister Ichiro Hatoyama paved the way for Japan's world-class system of universal healthcare in 1961. He established a comprehensive health insurance that covers all citizens. The policy-making process in Japan is very straightforward. Before the cabinet submits a bill to the Diet, they first identify the problem and gather information from health experts. Once the cabinet has all the background information, the cabinet meets with Social Security Council and the Committee on Health Insurance to finalize the bill. The bill is reviewed by the Cabinet Legislation Bureau before it is introduced. The ruling party then approves the bill, but if the ruling party does not support the bill, it will not be submitted to the Diet. Healthcare coverage in Japan has three structures, and they are employment-based health insurance system, the resident-based national health insurance system, and the medical insurance for age 75 and over. According to Health and Global Policy Institute, Japan's healthcare structure is the largest healthcare insurance programs in the world. The first structure is the employment-based health insurance system, which is subdivided into three schemes. The first one is the health insurance societies, mutual aid associations, and the Japan Health Insurance Association. Health insurance societies helps with large companies experiencing mutual difficulties, and the mutual association helps government workers. And lastly, the Japan Health Insurance provides assistance to small and medium-sized companies. The second structure is the resident-based national health insurance. This health coverage provides coverage for people who are self-employed, unemployed, and retirees under 75 years of age. Individuals who have this health insurance pay a premium rate, and the rest of the medical expenses is covered through public funding. The last structure is the health insurance for the elderly. This scheme was established to help people aged 75 and over to include bedridden individuals. This scheme was retired in 2008 due to the lack of transparency of how the contributions were actually spent. Later, the medical insurance system for the latter stage elderly was created. This new insurance system improved cost-sharing data and became the central location for premium payments. Individuals on this plan pay 10% of their medical expenses, and the remaining balance would be covered through public funds and the working population. The quality of care needs some improvement. Since Japan's delivery system ensures unrestricted access, the number of hospital beds per capita is extremely high. Cities such as Tokyo is facing serious challenges, such as shortage of healthcare facility beds as the population continues to age at an increasing rate. Patients are experiencing a lengthy hospitalization time, and the healthcare professional and bed ratio is low. The medical care plan was established to carefully manage the number of hospital beds, encourage the use of medical resources, and provide high-quality care through the proper maintenance of systems. The costs and benefits in all three healthcare schemes are similar. Hospitalization, outpatient visits, prescription medication, home visit, nursing, and dental care costs are all covered in all three schemes. Co-insurance is also the same across the board, and the medical cost is determined based on age and employment status. For residents under the age of 70, the co-insurance is set to 30%, 20% for children under the age of 6, and 10% for those with low income, ages 75 and over. Insurance premiums are calculated differently based on the type of insurance schemes. Japan has also implemented the medical cost optimization plans to suppress the increase of medical costs. To help with outpatient medical expenses, Japan is targeting to meet specific health examinations, promote the use of generic drugs, and implementation of point-based healthcare systems. Inpatient medical expenses will be mitigated by reducing the amount of patients spent in the hospital. Japan has a free access system, which allows citizens to freely choose their own healthcare providers and the frequency of treatment, regardless of the type of health insurance scheme. This system also grants physicians this freedom of practice and can specialize in anything as long as they hold a license. In conclusion, Japan is anticipating a rapid change in healthcare arena. Healthcare professionals are closely monitoring the country's demographics, accelerating urbanization, disease structure, and the impact of advanced technology.